This is our monthly meeting of the Global Nurses Climate Change Committee meeting for the Alliance of Nurses for Healthy Environments. As I said, today's webinar will be recorded except for the question and answer portion, and we hope that you do ask our amazing speaker questions throughout. I'm Sarah Bucic. I'm with Annie. We're joined today with our committee co-chairs, Dr. Melissa Kelly, and also Dr. Kent Boyd. So please do put your questions in the chat when our speaker is speaking. Today we will be hearing from Olivia J. Starantino, who is founder of Biome Planetary Health Solutions. Olivia graduated summa cum laude with honors from Lafayette College in Easton, Pennsylvania, with a BS in Environmental Science in 2023. She worked for a year out of college at Regeneron Pharmaceuticals in Rensselaer, New York, in a quality control chemistry laboratory. And last August, she started an online Master of Health Science degree through the University of Florida, studying global and environmental health, One Health, which she is currently pursuing. At the University of Florida, Olivia is also a student researcher studying resiliency to climate change in the West African Sahel. And in October 24, she left Regeneron and started Biome Planetary Health Solutions, LLC, which is a consulting company based outside of Albany, New York. Her work works primarily with local governments to address public health problems arising from the environment using a biome approach. And Olivia, we look forward to hearing what you have to say. So I'm turning it over to you.
Okay, thank you, Sarah, so much. Hi, everyone, and thank you for having me. I'm so excited to share a little bit about what I'm doing and how it relates to nurses. So I'm just going to share my slides here. Let's see. And if everyone can see that, can you just give me a, okay, we're good? Okay, excellent, thank you. So to get started here, let me just make sure, there we go. So a quick presentation outline for you all. So I'll start with my background and a little bit about my company that I founded. And then I'm going to jump into the definition of planetary health, which I'm sure many of you have probably heard before, but just in case, we'll go over that and why it's important, because that really is the foundation of a lot of the work that I do. And as Sarah mentioned, it's what really impacted the biome approach that I try to use at work. So then we're going to jump into the case study and the issue and what I'm working on, which is, arboviruses and arbovirus activity in New York. So we'll talk about how climate change influences those things, some examples of arboviruses of concern in New York State's response to those issues, and then what my own company is doing. And then in conclusion, we'll touch on what nurses can do and what you all should know. So before we get started, I just wanted to note that I'll be talking a lot about the environmental and, kind of arbovirology side of this. I know that there's a lot of clinical and symptom side of arboviruses as well, that you all will be able to research probably much better on your own than I could tell you about. So before we get started, just so everyone knows, the word arbovirus just means arthropod-borne virus. So it could be a disease transmitted by insects other than mosquitoes, but for this topic, I'll mostly be talking about mosquitoes. So like Sarah mentioned, a bit about me. I graduated from Lafayette. That top photo on the left is me conducting my undergraduate thesis work. I was studying an endangered wetland plant, which is neither charismatic nor economically valuable. So really just doing conservation, ecology, and restoration for the sake of inherent life and its intrinsic value. Right now, as she mentioned, I'm also doing a Master of Health Science in One Health, and I'm hoping to start a PhD in One Health in fall of 2026. So that's a little bit about my education. And then my involvement with planetary health really got started soon after I graduated college. So in 2024, I started volunteering for the Planetary Health Alliance as a youth ambassador. And in that role, I worked on the Connecting Climate Minds project, which was basically interviewing people that had experienced some sort of mental health struggle as a result of the climate crisis. So one example was people in California who had lost their homes to wildfires. So we spoke with them and then, collated all of their data and everything we learned into one big publication, which is available. So after college and after I worked at Regeneron for a year, I started Biome PHS, or Biome Planetary Health Solutions, in January 25. So it hasn't even been a year yet. So it's a very young company, and I'm very excited to be already talking about the work that I'm doing. So I'll jump into a little bit more of that on the next slide. But in March, I attended the Our Planet, Our Health conference in Washington, D.C., which is the photo on the top right. And that's where I met Milagros, who works with you all at Annie. And she, and I talked a lot about this. So she is fantastic. And then after that, this past summer, I participated in the UC Davis RX1 Health cohort in California. So that's that bottom photo. That's some of us at a ranch that we camped at for a week in the Sierra Nevadas. And out there, we were studying a mouse population on the ranch that sheds hantaviruses. So it's really interesting how all of these, environment and health systems and ecologies kind of connect. So, jumping into quick the definition of planetary health, and I'm sure you've all seen this before, but I wanted to highlight a few words that really jump out at me and inform some of my practices. So, first and foremost, this is solutions oriented, which means a lot to me because it means we're not just doing this at an academic or a research level. This should be on the ground, making change happen responsibly, but also locally, and it should be long lasting, right? We don't want to just drop in somewhere and build a well and walk away and then have the well be contaminated or not work in 10 years time, right? This has to be long term. So it's also transdisciplinary, which you all know much about. Your nurses here talking about climate change, so that's fantastic. This needs to be a collaboration between, environmental scientists, economists, government agencies, and everyone else. And it's also a social movement. So you'll remember Milagros and I were in DC. We were actually talking to Congress members about the connection between health and our environment. So that's important, and we'll come back at the end of this talk as well. And kind of the meat of the definition, it focuses on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. And I'd just like to note, some of you might have heard of the term One Health before. My degree is actually in One Health, and I think the definitions are extremely similar. I haven't found any like published distinctions between the two, but in my mind, the difference is that planetary health is a little bit broader in scope. So, for example, my honors thesis work that I did at Lafayette College, where I was working on restoring an endangered wetland plant, I could consider that a planetary health project because I was working for the life of something on Earth for its intrinsic value to restore its health. Whereas what we were doing in California with the rats shedding the hantaviruses, that might be considered more of a One Health issue because human health is directly involved. So that's kind of how I think about that. But if you have questions, feel free to ask me at the end about that. Okay, so on to my company. So I started Biome because when I came out of college, I really wanted that solutions-oriented local experience in planetary health. And I'm from upstate New York, right outside of Albany. And looking around, I really couldn't find anyone that was doing that, right? So I wanted to be able to work with local government, with local communities to analyze planetary health issues and then implement solutions on a local scale. So that was kind of the idea. So our goal overarching is to promote human well-being through the cultivation of a healthy and thriving environment. And what I call the biome approach is essentially that we are thinking of and taking into account the entire biome when we work on a solution. So applying pesticides just as a go-to quick answer probably isn't the best solution for the entire biome, right? So we try to take everything into account and think about that when we're solving these issues. And you can go to my website if you want to learn more. It's on the bottom, www.biomephs.com, but I'll have that on the last slide too. So you don't have to scribble it down now. All right, so jumping into the case study here and really the meat of what we're talking about. Mosquitoes are the deadliest animal in the world. They kill around 1 million people a year. And many people don't actually know this, but there are many species of mosquito, over 3,000, and not all of them transmit disease. Some mosquitoes actually just drink the nectar from plants and don't bite anything. There's a very few number of those, but there are a few. Another thing a lot of people don't know is that only the female mosquitoes bite. So they're the only ones that take a blood meal. It's kind of gruesome, but that's the term. So the male mosquitoes just, take nectar from plants. So they are implicated in the transmission of diseases like Zika, lymphatic filariasis, yellow fever, dengue, which is also called breakbone fever, and malaria. And malaria is the leading cause of preventable death and illness in the world, which I'll talk a little bit more about later. So these are some of the more visible symptoms of some of these diseases. So elephantiasis is from lymphatic filariasis. This is actually not an arbovirus because it's a parasitic disease similar to malaria, whereas Zika is a virus, and this is a photo from the outbreak in 2016. So it's important to note that when you're thinking about these diseases, they're not all arboviruses. Like I said, some could be parasites or something else. So just something to keep in mind as, a healthcare provider. Okay, so how is all of this connected to climate change? So these two mosquitoes pictured here, Aedes aegypti and Aedes albopictus, are both invasive. If you haven't heard that term before, it means that it's invading into an area that it did not previously inhabit. It's not native to this area. Now, these are two invasive species specifically to the United States and more so the eastern coast, but there are invasive species everywhere. And I'm sure if you're from somewhere else in the world, you probably have your own species of invasive mosquito, probably even these because they're pretty widespread. So they're implicated in the transmission of dengue, Zika, chikungunya, and in the case of Aedes aegypti, also yellow fever. Now, they do look very similar, but I do have a little key on the bottom left-hand corner here on how to distinguish them. On their scutum, which is actually the back part of the mosquito, Aedes aegypti has white scales that look like a lyre, like this over here on the left, and Aedes albopictus has a straight line all the way down. So that's just a quick way in case you were interested in distinguishing them. So the reason climate change is really an issue here is because with a changing climate, we all know temperatures are increasing, but also precipitation patterns are changing. And for these mosquitoes, that means that there is more habitat that they are able to thrive and survive in than there was previously. But interestingly, with these specific species, is that plastic waste in particular is also a driving factor of their expansion because these mosquitoes breed in artificial containers. So tires are a frequent one. Also, like takeout containers. Like if you go to, I don't know, a restaurant like the Cheesecake Factory and you get those plastic containers and then you throw it out the window, that's a perfect breeding ground for these specific mosquitoes. So, as climate change persists and as urbanization persists and more rural areas become urban, these mosquitoes really thrive. So, it's something to take into account when you're thinking about, places and change generally and what diseases might be lingering there. So, together, these issues are contributing to an increase of arboviral diseases globally. So, this is not just a local issue for New York or the United States, it's happening around the world. But if we want to take a look locally, here's a map of New York State. So the part I circled down at the bottom is where Aedes albopictus mosquitoes have been reported. So this species of mosquito has established a colony as far north as Orange County, which is, basically all of New York City. So if we look at this map, one important thing to notice, if you haven't already, is that the counties highlighted without any gray fill are counties where no mosquito surveillance is occurring. Okay, so from Orange County all the way north to the Canadian border, we have no data. So we really don't know, right, if these mosquitoes have persisted farther north than Orange County. All we know as of August 9th of this year, because that's the most recent published data from New York State, is that they're in Orange County. So we'll come back to that later when I talk a little bit more about my work. Oops. Okay. So some examples of arboviruses in New York. These are some non-endemic viruses. So non-endemic essentially means that the virus itself isn't persisting in our environment. So we have chikungunya, which is generally fever, joint pain, muscle pain. There's no vaccine available, no treatment. Dengue, also called break bone fever, because it feels like patients' bones are actually breaking. It's awful. There is a vaccine for this, but interestingly enough, it is only for children aged 9 to 16 with a previous infection of dengue. Dengue is very interesting because there are different serotypes of the virus. And if you get one serotype and then another in a specific order, that's when the disease gets very severe. So that's why this vaccine is a little interesting. There's a lot you could read into about that. Dengue is very interesting. And then malaria, we talked about treatment does exist. If you've ever been to a malaria endemic country, you probably took those anti-malarial pills. I know I have. They're widely available and fairly easy to get. They do cause some crazy dreams, but other than that, the problem with treating malaria is more of an access and access to the treatment for the people that need it. So that's very interesting. And then the Zika virus as well causes fever, rash, and birth defects. And if we look at the data in New York as of August 9th of this year, you can see that we actually have had cases of these diseases in New York. So there were 31 malaria cases, no Zika, luckily, but 20 dengue cases and 2 chikungunya. Now, the important thing to note here is that there was no local mosquito-borne transmission identified in these cases. So all of these people either traveled somewhere or had a blood transfusion or had some other method of contracting the virus or the parasite without being bit by a local mosquito, as far as we know. Okay, West Nile. So now we're getting into our endemic ones, and there are only 2, so I'll keep this kind of quick. So West Nile is considered one of the more mild ones, but I feel like if you talk to anyone who has had West Nile, they will not tell you it was mild. It causes fever, headache, body aches, vomiting, diarrhea, rashes. It's basically febrile illness. And 1 in 5 people that are infected will develop these symptoms. 1 in 150 will develop serious illness, which can sometimes be fatal. So again, looking at the map of New York here, this is as of August 9th, the most recent data available. Outside of New York City, we've had 141 positive West Nile virus pools. Now, I'm going to describe what pools means because you might not have heard this term in this context before. When you go out and monitor mosquitoes, the first thing you have to do is identify them to the species level because mosquitoes of different species bite different things. So they might have different diseases. So we separate them by species. Then, depending on the lab that you're using to test your samples, they will ask that you put between 5 and 60 of the same species of mosquito in a little Eppendorf tube. So that's essentially one pool. So if I sent 55 mosquitoes to the lab and that pool came back positive, there could be 1 positive mosquito or there could be 55 positive mosquitoes. We don't know. So that's where statistics and risk assessments come into all of this. But using the pools, we can get a pretty good idea of what's out there. So if we look at this map, the rust color in Erie County and Onondaga means that there were human cases of West Nile virus and positive mosquitoes or mammals. The solid orange just means that there were positive mosquitoes or mammals, no people. So you can see that, oops, sorry, let me go back. You can see that in New York City, there were quite a lot of positive pools, 628 actually. And then there are 2 counties that have no West Nile virus reported at all. So moving on to Eastern equine encephalitis. This is where I come into the story because this disease is crazy. So this is a rare but very serious disease with no vaccine for people or cure available. There is a vaccine for horses, and that plays into the story as well. So symptoms include fever, vomiting, diarrhea, behavioral changes, seizures, drowsiness, and of course encephalitis. And of the people that develop encephalitis, around 30% of them will end up dying. And I've seen that number much higher in other reports. This is from the CDC. So it's not clear exactly what that number is, but it's high. And survivors often suffer permanent neurological symptoms, which can be very bad and lead to death further down the line. So this is a really, truly awful disease, and it's endemic in New York. And a lot of people haven't even heard of it because it's so rare. So looking at the situation right now, as of August 9th, we've had 23 triple E positive pools in New York State, none in New York City. We have also had 3 cases in flightless birds. So this is usually emus or large exotic birds. This disease actually has a reservoir in the native songbird population. So what happens is an infected mosquito will bite a bird. That bird won't get sick, but the virus will replicate very readily. And then another mosquito can bite that bird and get sick and transmit it to a human or a horse. So another interesting thing to know is that the mosquito that bites the original bird frequently isn't the same species of mosquito that bites a person. So usually there's this one species that bites a bird, and then a second species comes along that is less specific. They like birds, but they also like horses, and that's how the virus spreads. So something to note here about this map where the monitoring counties exist. You can see there's that group down in New York City, and then there's a group all the way out west and a group in central New York, and then we have St. Lawrence County all the way up north. St. Lawrence is the newest county monitoring. So they started monitoring this year. And you might be wondering why these counties are kind of clustered like this, why these areas of New York are monitoring while the others aren't. And there's an interesting story here in that if you're not from New York, you might not know, we do have some Amish populations that exist primarily out west and in central New York. And typically, the Amish populations don't vaccinate their horses. So much of the rest of the state does. So those horses have actually served as sentinel species for triple E, essentially meaning that when they get sick with triple E, they're not protected from the vaccine and they end up dying. So county health officials have become very aware of triple E positive cases out in those areas because of these sentinel horses. So that's why these counties have been monitoring for so long. And 3 counties this year have actually already started spraying pesticides to kill these mosquitoes because of this. So jumping into the issue here, in September of 2024, where this red star is right here, there were 2 emus that died of triple E. So again, this is a sentinel species telling us that triple E is in the area, and we don't get that with a lot of horses in the capital region because typically our horses are vaccinated. So that's kind of where I come into this whole story because I am from Rensselaer County and I live not very far away from where these emus died. So this was a very local issue. And if you remember, I founded Biome in January of 2025. So this was happening, kind of right at the same time I was thinking of this company and getting ideas and things. So this is all happening in the same place at the same time. So before I explain what I'm doing in response, I'd like to explain what New York is doing. So again, this is a map of all the counties that monitor. Now, New York City does their own thing. They have the Department of Health and Mental Hygiene, and they do a very comprehensive job of monitoring mosquitoes throughout New York, which is great because, like I mentioned with the invasive mosquitoes before, those mosquitoes do really well in urban areas. And we can see that we already had a population of Aedes albopictus in New York City. So it's great that they are monitoring down there. That really should be done. That's fantastic. Outside of New York City, it is left up entirely to the county health departments to decide if they would like to monitor for mosquitoes or not. So these are the counties that decided, and it's actually only 11 of 57 counties outside of New York City that monitor, which is 19% of the counties. So not very much. Clearly, we have a highly deficient data set here. So that is very interesting. And another thing to note with this is that the counties do collaborate and talk with one another, but their methods are quite different, not only from each other, but from other states in the Northeast monitoring for mosquitoes. So what's happening in Vermont looks very different from what's happening in New York. And that makes it hard to compare data sets and do data analysis in that way. Now, I'd also like to note that the New York State Wadsworth Center Griffin Laboratory, they are fantastic. I work very closely with them, and they're located in Albany County. So that's kind of right smack in the middle of the data deficient zone. So they are the ones that test all of these county samples for the arboviruses of concern. They also perform extensive arbovirology research. They are really an amazing resource. So New York is on top of it. It's just a matter of getting more counties the resources and, the education and the ability to monitor for mosquitoes. So, jumping back to the problem and my involvement, I'll remind you 2 emus died in Rensselaer County of triple E in September 2024, but no monitoring was being done in the capital region. So, when I started my company, some of my first moves were talking to as many local officials and just people involved with the health and environment community as I could. So, I spoke with my county health department environmental health director, and he said that he was concerned about triple E. Just in general, because of what had happened in September, he was concerned that it could pop up again this year. But unfortunately, the county didn't have the resources to begin monitoring. So, through my company, I took it upon myself to start a small pilot study, very small, just a few sites, starting in June through November of this year. So, monitoring is happening right now. I am monitoring mosquitoes at a site very near to where the emus died in Rensselaer County. And to get into all of this, I really had to understand the methods that were going on, not just in New York State, but around the Northeast. So I talked to the counties in New York that were monitoring. I went out to Vermont to visit their program. They have a statewide monitoring program. I went to Massachusetts twice to talk to them and learn about what they were doing. And I also spoke with the folks from Connecticut. So I really tried to get a full picture of all the methods and the tools that were being used across the Northeast before I started. And the methods that we decided were best were to use resting boxes and CDC light traps. So, resting boxes, you can see in the top photo on the right, they're just black boxes basically that you set down in the woods, and that's me with a my aspirator, which is basically a modified electric leaf blower. So I cracked it open, turned the fan around so that it acts as a vacuum, and that is a pair of pantyhose on the end. So basically, what happens here is that after the female mosquitoes go and take a blood meal from a bird or a person or a deer or whatever else might be out in the woods, they need a place to rest and digest and develop their eggs. And they really like these dark enclosed spaces. And a lot of people in the mosquito monitoring world will tell you that these resting boxes don't work very well. They don't catch a lot. For some reason, at my site, they're catching so many mosquitoes. So that's really great. So I go in there with this vacuum and just suck them all out. And then the second trap I use is called the CDC light trap. And that's the one with the net down at the bottom in the bottom photo. And that is basically a light bulb connected to a battery with a fan that blows attracted mosquitoes to the light down into the net. And then I just close the net and put it in the freezer, and there you go. Some people that use CDC light traps like to use carbon dioxide as a bait because mosquitoes are attracted to the CO2 that we're exhaling. I decided not to do that because a study came out last year that said the mosquito of interest, the one I'm looking for, the one that transmits triple E to the birds, is more attracted to CDC light traps without CO2. So that's something that I decided to do. Most of the counties in New York don't do it that way, but that's just one small difference. So then the next thing I had to do was learn how to identify mosquitoes, which is much more difficult than it sounds. Luckily, the Northeast Mosquito Control Association is a fantastic resource. I highly recommend if you guys are interested to talk to them to learn more about this. They host a mosquito identification course every year. This last one was in May and it was in Cape Cod. So lucky for me, I got to go to Cape Cod for a little while to learn how to identify some mosquitoes. And after a lot of practice, I'm pretty quick at it now. So it takes some work, but you get used to it. Once they're identified to the species level and put into their pools, they go off to the lab where a 10 virus panel is conducted. So they're looking for not only Triple E and West Nile, but Jamestown Canyon and a few others. If you're interested, I can tell you all of them. They also perform blood meal analysis. So this is really cool. So if a mosquito is tested positive for, say, Triple E, and they have blood in their midgut, so they've taken a blood meal when I trapped them. The blood can be tested to see which species it came from. So we can see, is this mosquito biting a person? Is it biting a bird? If so, what kind of bird? And that will give us a good idea of the reservoir of this disease. They also perform cell culture in the lab and isolate the viruses in question. And so, like I mentioned, this is a really small study. I have one site, but I did add a second site very recently, just this month, for diversity of data because one site really isn't enough, but I am working with limited resources here. So, doing everything I can. And to date, so far, I've collected over 8,800 mosquitoes and I've identified all of them and sent them off to the lab. I'm still waiting on results, so unfortunately, I can't share results with you all today. Maybe if our talk had been a month later, I could have shared some, but if you're interested in following along, feel free to reach out to me. I'm also hoping to present this research at the Northeast Mosquito Control Association annual meeting in December. So hopefully that will work out. And another interesting thing to note here with this study, I have not seen any Aedes albopictus or Aedes aegypti mosquitoes. So this is interesting. My caveat here is that I am sampling a natural environment, a big wetland where the mosquitoes that transmit triple E typically exist. And as I said, these Aedes species typically like the more urban and, artificial containers for breeding. So it's possible that they're just not in this microhabitat where I'm monitoring, but I haven't seen any, so I can't say that our information that they have gone as far up as Orange County is incorrect. But I am keeping my eye out on that and reporting. I'll report if I find any of those. Oops. Okay. So the goals of this study, first and foremost, my goal here is to inform the Rensselaer County health officials of any potential arboviral threat in the area. So they, even though they haven't been able to do the monitoring themselves, they are aware that I'm doing this monitoring and they're my first call if I find anything. So that's kind of the main focus. The second goal is to begin to fill this large data gap in the capital region. So ideally, if I find anything or even if not, this monitoring will continue and continue to grow as the years go on and we get more resources and my company grows and things like that. I've also talked to some New York State local government about starting a pilot program to provide funding for the counties to do this monitoring. So that aspect of this I'm working on as well. And then finally, I'd like to create a standardized monitoring approach that can be quickly implemented in any New York county. And the reason that's important is because, like I mentioned before, the counties in New York, when they decide to monitor, they use whatever methods they like. And a lot of the counties that don't currently monitor, they don't only not have mosquito traps, they don't have the personnel to go out. This is a full-time job to go out every day, collect mosquitoes, bring them back, identify them, send them to the lab, and do all of those things. They also don't have the training to do all of those things. You know, there's a lot of research and work that goes into understanding how to even run these traps, let alone identify the mosquitoes. So through my company, what I would like to be able to do is have a program that I can quickly implement in any county that wants to monitor for mosquitoes. So that could look like giving them a guide if they want to tackle it themselves. Like, here's what you need to know, here's what you need to do, here are the methods I used. But it could also mean using my traps, using my own technicians to do the monitoring for them on a consulting basis. So that's kind of the goal with all of this. Okay, and finally, for you all nurses and where you come in, so you are all so trusted in your communities and obviously on the front lines of these emerging arbovirus diseases. So the first thing that I think is important is to just know the symptoms of arboviruses in your area. I'm probably not the one, I don't have a lot of clinical background or research, so I'm gonna leave that mostly to you, but I did find an article that said if a patient is presenting with aseptic meningitis, and/or encephalitis during tick or mosquito season to consider an arbovirus. Many of the nationally reportable arboviruses go underdiagnosed, including Triple E and things like West Nile, which are both nationally reportable. So it's something to think about. And the mosquito season might be longer than you expect. It's not just peak summer. It's actually from kind of late spring, so like late May, early June, all the way into November. And you might notice this October coming up that you might still get a few mosquito bites around October. So it's actually kind of shocking how long they can persist. And the second point is when talking to patients, remember to ask about the ecology of where they live, right? So do they live near a wetland or are they working in an urban environment where you know, because you just researched this, that Aedes albopictus has just formed a colony, right? So those are all good questions to ask. And then obviously you all know, have they traveled to an area endemic with arboviruses and things like that? And then lastly, I would just like to remind everyone that planetary health and, mosquito monitoring and all of this is as much a social movement as it is a science. So if you'll remember, Milagros and I were in DC talking to Congress members about all of this stuff, and that's super important. And I think you all, have, as nurses, even more than me, who's just someone working in this field, really are trusted in that way. And I think your voices go a long way. So if you advocate for not only mosquito, but tick monitoring and things like that, that could go really far. So I would appreciate that. I know a lot of other people would as well. So these are just some of my references, a lot of from the CDC, a lot from the New York State Department of Health, and some academic articles. If you have any questions about those, feel free to let me know. And then I'll just say thank you. And I went a little quick, so I apologize about that. But that's my website and my email. Feel free to reach out to me. And if you happen to be in Cape Cod in December at the Northeast Mosquito Control Association conference, hopefully I'll be there presenting my results so I don't leave you on a cliffhanger. But thank you all so much. And I would answer any questions you have.
Thank you so much, Olivia. This was excellent information. And I see in the chat